when all is said and done, I think is going to have a mortality rate of 0.2 to 0.4%, which is far lower than the mortality rates of most of the other diseases out there. There's just a multitude of untoward outcomes that have not been accounted for with this medical lockdown. I'm Dr. Stephen Hearn, an interventional cardiologist, and this is my second opinion. The patient was a gentleman in his 60s who was having chest pain for well into a day. His family was encouraging him to come to the hospital. He declined because he was afraid he would catch the virus. He basically waited to the last minute. 911 was called, EMS showed up, and he arrested right there, had CPR, and didn't make it. This was a gentleman who clearly could have been saved had he not been afraid to go to the hospital because of all the media hype and the worry that they're going to catch a virus with probably a less than 1% mortality when they're having a disease that left untreated, a much, much higher mortality. A lady, similar circumstances, who stayed at home for 24 hours with a stroke. Her neurological status could have been saved, but however, because of fear of coming to the hospital, which she declined to do, she was left with a very dense left-sided body stroke, which there will be no recovery for. My wife's an emergency medicine doctor who has seen very many things as well, patients that have stayed home too long because of the media hype about catching a virus in the hospital.